Good morning. My name is Darla Nichols.
Blake Krasinski.
Good morning. Good morning.
Carla Nichols.
Jackson Henry.
Jackson. Sam.
And we represent the Ansley FFA Chapter. Today, we will be covering many different safety procedures concerning syringe needles, different types of syringes, and the importance of knowing how to read a vaccination label. We will be demonstrating 5 different injections, including their site of administration and a brief summary over each injection.
For today's demonstration purposes, we'll be using the yearling heifer. Typically, when injecting calves under 300 pounds, you should use an 18 to 20 gauge needle that is ½ inch to inch long. This is typically because longer or bigger needles can more easily harm the animal. When injecting animals, it is important to make sure that your equipment is clean and sanitized. It is also important to make sure that the needle is not bent or broken. This is important because you can spread infections and harm the animal. If this is not able to be done safely or sanitarily, it should be stored in a labeled truss container.
Now I will explain how to properly fill a syringe. Today we are using dye as a representation of vaccine or medicine. First, you take the cap off of the needle. Then carefully inject the needle into the top of the bottle. Tip the bottle upside down and slowly pull out the end of the syringe to fill. Once the syringe is filled to the amount needed, slowly take the syringe off of the bottle. Check to make sure that there are no air bubbles. If you detect air bubbles, lightly thump the side of the syringe and then push in the end of the syringe to get the air out. Then your syringe is ready to use.
Today, we will be specifically focusing on the 7-way clostridial vaccine. 7-way is the most commonly used vaccine in cattle. 7-way is given to calves under the age of 2 years and protects against 7 different types of diseases. This vaccine is also known by Ultra 7 and Somuvac.
Knowing how to read a vaccination label correctly is crucial. It's important to know proper storage, dosage, and withdrawal times. Proper storage for the vaccine 7-way is 2 to 7 degrees Celsius or 35 to 45 degrees Fahrenheit. Proper dosage for a calf at least 2 months of age and under 300 pounds is 2 milliliters, followed by a second dose 4 to 6 weeks later. The withdrawal time for this medication is 60 days, which means that the calf cannot be slaughtered until 60 days after the vaccination is given. This vaccination should be administered subcutaneously.
Today we will be starting with one of the most common injection sites, intermuscular or IM. IM injections are injected straight into the muscle, allowing the medicine to be absorbed more quickly and be active longer. To give the injection is given in the ventral gluteal muscles found in the triangle shape of the neck. To give the injection, first you thump the area to desensitize the animal. Then you give the shot, inject the medicine, wait a few seconds, then pull the needle out and proceed to rub the area to disperse the medicine well.
Again, for today's purposes, we are using dye as representation of the vaccine, and an orange is serving as the location site. As you can see, the dye went straight into the muscle.
Secondly, I will be covering another very common injection type, subcutaneous or sub-Q. Subcutaneous injections are given just underneath the skin, just underneath the tissue layer, in between the skin and the muscle. Medicine given this way is usually absorbed more slowly, sometimes over a period of 24 hours. It is recommended to use a short needle. To inject subcutaneously, you put the needle in between the skin and the tissue layer. If you get it in the muscle, then it can cause several damages. Medicine given this way is usually more effective if other types of medication will not work.
Again, we are using the dye with the banana to represent the injection location. As you can see, the dye went under the skin, but none went into the muscle.
Intravenous, or IV, is the next injection type we will be discussing. Intravenous injections are most often used for sick animals. Intravenous injections are injected under or through the skin, directly into the vein. A vein can be damaged during this injection, which will cause infiltration. When this occurs, medication leaks into the surrounding tissue instead of going into the bloodstream. IV injection sites are located in the jugular, which is located by the throat, the milk vein, which is located at the base of the cow's udder, and the tail. However, the maximum amount of medicine able to be administered into the tail is 2 cc's. This is an IV set. An IV set helps vets when they are doing this kind of injection. However, a needle and a regular syringe will also do just fine. When you are administering this shot, you pinch the vein to get a bulge and put the needle in the direction away from the cow's head down into the vein.
For today's demonstration purposes, we are using a Ziploc bag to represent the skin and a straw to represent the vein. As you can see, the dye went straight into the straw.
Next is oral administration. This is a form of administration where a medicine is taken directly through the mouth. Most oral medications come in the form of a very large pill called a bolus. However, other oral medications can come in the form of a liquid or a paste. For today's purposes, we will be using cake to represent the bolus. First, you will insert the bolus into the bolus gun. Next, you will insert the bolus gun down the middle of the calf's throat. It is best to initiate the swallowing reflex once the tip of the bolus gun is at the entrance to the esophagus. Once the bolus gun has reached the tip of the esophagus, you will slowly let the bolus gun work its way down until the tips of the gun is at the calf's lips. To keep the calf's head elevated and stroke the throat to help it encourage to swallow. Other oral medications are fluid and paste. These can be given through a no-crimp fluid feeder. In the case where the fluid feeder is too big, a drench syringe may also be used.
Intranasal is the least used and final method of administration we will cover today. Intranasal is the method of administration within or through the nose with a nasal inoculation tip, or more commonly known as a cannula tip. A shortfall of these vaccines is that they have a relatively shorter duration of activity. Most of the antibody production takes place in the fluids through the nose, throat, and windpipe. Now we have covered many safety procedures concerning syringe needles, the different types of administration, and how to read a vaccination label,
as well as demonstrating the different types of vaccinations, where they're located, and how to do it.
We would like to thank you for judging today and proceed to any questions.
I have one. Do you worry about air bubbles in the syringe?
Yes.
This is because if you get pockets of air in the animal's muscle, it can help deteriorate the muscle because there can be other bacteria in the air pockets.
So what do you do to guarantee there's no air bubble?
You
dump the
it,
syringe,
and then you wait
push
till
the air
you push the air out, and then once you see liquid coming out the top, then you stop.
If there's air in it, you can tell because there's a gap.
You easily see it.
Do you ever have to push some air up into your bottle before you pull the plunger back?
Yes.
Yes, and when we prepared today, we did that so it would be more time effective.
Okay. You said a 7-way vac is good for 7 different beef cattle diseases. Can you name 2 or 3 of those?
The main strands that protects against is 7 different strands of blackleg. So there are multiple names, and I can't pronounce the names of them because they're kind of long.
The Clostridium thing?
Yeah.
Okay.
I noticed that you didn't use safety equipment. Do you normally use safety equipment when you're doing vaccinations, such as eye protection or gloves?
Gloves, that's a very common thing. So eye protection on a ranch or on a feedlot, eye protection maybe not, but gloves, that's pretty general. You should probably wear gloves.
So when you were doing it sub-Q, I believe it was, you said you wait a few seconds before you pull it out, the needle. Can you tell me why?
That's to ensure that medication doesn't come back out of the injection site. Because if you pull it out too fast, either some of the medication will come out back out with the syringe, or it'll start to like squirt out. So you want to make sure that you get all of the medication that you are intending to inject to stay into the calf.
And if you pull it out too quickly, then you will harm the calf.
When you're using the balling gun or doing a drench, how do you make sure you're getting into the esophagus, not into the windpipe?
So
Especially when you're doing a drench.
So you can tell so the esophagus is right behind the windpipe. So if you stick it down the throat, and 90% of the time the tube will go down the throat, but there's that chance that it'll go down the windpipe. So when you're drenching them, you keep the bottle down, and you can move the tube to feel the tip of the ball of the tube, and then you'll feel it. And once you can feel it, you can tip it up because the windpipe is hard, so you won't be able to feel that, and the esophagus
Okay.
is soft.
And you kind of let them kind of swallow a little bit too, right?
I noticed that they did that when they were putting bolus in.
What happens if your injection goes bad? Do you go back and get more of the medicine and re-inject? I mean, what is the protocol like? Can you
If the injection, like the medication goes bad,
No. I mean, while you're doing the injection, some of it went in and some of it went out. What happens? Do you go put more in your syringe?
so typically when that happens, you just don't give it more because you don't know how much went in, and you don't want to overdose the animal and get sick and possibly have it die on you. So you wait till the withdrawal date and then give it again.
It's better to wait and risk not giving it enough than give it too much.
Have any of you, in working with cattle, given injections, ever had a needle stick of your own?
Good question.
Are there any products out there you have to be really, really concerned about?
There's certain products, like Duraxin, like that was a very deadly vaccination if given wrong, and it's very important that you don't get any of it in your system, otherwise you can possibly die.
Okay, thank you.
I think I'm okay with questions. Is that
Yeah,
fine?
I'm done.
Thank you for judging.
Thank you.
Good job.
Thank you.
Good job.
Thank you.